Good afternoon, everyone who's joining us today. First of all, before we begin our sessions, allow me to introduce myself. My name is Desi, your moderator for today. I'm currently a student in Indonesia School of Government and Public Policy, majoring in public policy with research focused on education policy response in COVID-19. Today, our webinar is very interesting topic, had a very interesting topic. We have two speakers joining us today. Our session today will talk about the COVID-19 challenges for the policymakers. Joining us today, we have two distinguished speakers who are the expertise in this field. They will be sharing to us about the Australia government efforts in tackling the COVID-19 at policy level. Before we begin, I would like to introduce to you our speaker. The first, we have Jayne. Hello, Jayne. How are you today?
Selamat sore. Ya, baik.
Selamat sore. Thank you for joining us, Jayne.
Thank you for having me. Really excited to chat with everyone today.
Yes, Jayne is actually a holder of Bachelor of Arts. He majored in politics and international relations alongside a diploma of language in Indonesia. So she can talk in Bahasa, as you can hear before, from the University of Melbourne. She's also a participant and spokesperson for the Years Australia-Indonesia Youth Exchange Program, being held virtually this year. And Jayne is currently working as the policy officer at the Australian Government Department of Education, Skills and Employment, or the EEC, on a task force overseeing the implementations of a new package of reforms to the higher education sectors. Before this position, Jayne has taken roles across the higher education division, including developing students' communication products and implementing short course. So if any of you are interested in joining short course, maybe you can ask Jayne later. Jayne also has a strong passion for supporting educational outcomes regardless the student background. Jayne coordinates Dream Seeds, a program that aims to build aspiration, resilience, and connection in primary school students from regional areas. The next speaker, we have the distinguished Kate. Kate is also the policy advisor to the Victorian Department of Health and Human Services COVID-19 Directions and Strategy team. She works in an agile team to design the policy underpinning Victoria's COVID-19 directions, and Kate's primary role is at International Policy Advisor with the Victoria Department of Premier and Cabinet. She specializes in the South and Southeast Asia, including the engagement with Indonesia, India, and the Timor-Leste. Above all, Kate values educational equity and supporting young Australians looking to pursue careers in this international policy making and diplomacy. So if any of you interested in diplomacy and education role within, Kate is the right person for you to ask. So without further ado, our first speaker will be Jayne. Jayne, would you like to kindly share your knowledge with us today? And the time is yours.
Ya, bisa. Boleh share screen?
Yes, please.
Oh, it's disabled. Mas Dani boleh.
Can you allow her to share screen?
Maaf. Tunggu sebentar.
Okay. We can wait.
Okay.
You can share now.
Bisa, makasih.
Yeah.
Okay.
Yeah?
Yes, it's on the screen now.
Fabulous. Okay, I will speak in English just for my for it to be a little bit easier. But yeah, hello everyone. Thank you so much for joining today. As Desi beautifully introduced, my name is Jayne and I'm currently a policy officer at the Australian Government Department of Education, Skills and Employment. So it's a big department, and I'm based in Canberra, which is the capital city of Australia. And that's where a lot of the federal government, the top tier of politics, that's where all of the government takes place and where all the major offices are. And I joined last year, at the beginning of last year, as a graduate, and now I'm just a kind of policy officer, sort of working my way through the various areas, and I'm currently based in the higher education sector. So just a little bit about me. Kenalkan, namaste, Jayne. I was raised in Victoria, which is where Kate is currently based, our other speaker. And I grew up in regional Victoria, so approximately 1.5 hours from Victoria's capital city, Melbourne, near the Puntai, near the beach, which is lovely. I attended the University of Melbourne, where I got a Bachelor of Arts, and I majored in politics and international relations, as well as a Diploma of Languages, where I majored in Indonesian, which is great because I actually was really fortunate to study Indonesian at primary school, like high school, and at university. So I'm very much a big fan of Indonesian language and culture, and bisa berbahasa kalau mungkin. And yeah, as I said, now I'm employed at the Department of Education, Skills and Employment. I joined as a grad where I did a couple of rotations, particularly one was in a team aiming to promote languages and literacy and numeracy, particularly in like school-aged children. And now I've been working in the higher education sector. I first started on a team who was providing student communication products to students, so they knew kind of the different types of government assistance they could access. And since then I've moved into more of like a policy space, particularly on the reforms that have occurred because of COVID-19. And so that's been because of that, 2020 has been quite an interesting year for me. And Kate and a lot of other government workers all around the world, I can imagine. But I think in terms of the outline of the discussion, I am really excited to talk to you about how higher education has been impacted in Australia, because it's certainly one of the largest sectors which has been impacted. But I think as a starting point, it's really important to outline how Australian government policy works and the different levels of government, because that provides like a really nice bit of context for some of the challenges that Kate and I are about to talk to you about today. So firstly is like a slide I have about government in Australia. So a little bit like Indonesia, we have lots of, in Australia, we have 3 tiers of government. And that is the federal government, the state government, like similar to provinces, as well as the local government. Kate currently works in the state government and I work in the federal government. Like everywhere, depending on which level, every level of government has different levels of responsibilities for different issues. So at the federal level, they oversee issues like defence, immigration, Medicare, so like a bit like Obamacare, but Australia's version. And at least in the context that I'm going to talk to you about, they, at the federal level, we fund universities. So that's really important to know. State governments are really, their kind of main issues are things about like hospitals and schools and public transport and roads. And in the COVID context, have really been in charge of overseeing like restrictions at the state level, where how people can move and what they're allowed to do because of COVID-19. And then of course you've got the local level, and we won't touch on that too much today, partly because Kate and I don't have experience, but at the local level, they are in charge of things like town planning and sewerage and rubbish collection and things like that, the sort of everyday sort of stuff. So that's just hopefully a bit of context for you. I think what's important to emphasize from this diagram is, even though there are 3 levels of government, and it might seem like the federal government as the top government is really important, the way Australia was founded as a place of lots of different colonies, which then became our states, it means that, at least in constitutional terms for Australia, states have a lot of power and they control, a lot of things that occur within their own borders. So in terms of COVID restrictions, it's been a really interesting challenge to have one consistent approach to how we tackle coronavirus. So if I flick to the next slide, this is just for everyone, this is actually a slide about our National Cabinet. And National Cabinet was established this year because of the coronavirus. And what it's showing in this picture is our Prime Minister. He's currently the one without the hair at the back. And all of our premiers, and premiers are the people that are in charge of all the states. And so basically they're having a discussion and trying to sort of build consensus between the federal and the state levels of government. And that's really important because until coronavirus, we didn't have this national cabinet arrangement in place. We had an arrangement called the Council of Australian Governments, but they really didn't meet that frequently. The conversations between federal and state were very infrequent. And because of coronavirus and because of a need to have one consistent approach across the nation and to ensure that that was consistent in states, the National Cabinet was established. Now, it hasn't been perfect. When you've got states that have a lot of power, as well as the federal government, and a lot of them have different political views, like they come from different political parties. They don't necessarily see eye to eye on issues all the time. So that's, I think, it's been an interesting challenge between the two levels of government this year. But this is just one way, I suppose, that was quickly set up to address some of the issues of, rolling out a response to coronavirus. And so I suppose I'll just run you through some of the main things that Australia has done at the federal level, so the top level of government, to address the issues of coronavirus before I dive into the higher education issues. So I think I've got 4 things here: travel bans and mandatory quarantine, JobKeeper and JobSeeker, a COVID vaccine, and the expansion of telehealth. Now, this is not an exhaustive list, but these are some of the major things that I think Australia has done particularly well and have been quite key policies that have really helped us to manage the coronavirus. So the first one is travel bans, so stopping all overseas travel and preventing overseas travellers from coming to Australia. And for any people who have to come to Australia or are coming back overseas, they have to undertake a 14-week mandatory quarantine period. In Australia, that presented a bit of an interesting scenario because we used hotels for a lot of that quarantine. So I think Kate will touch on that a lot because states ran that hotel quarantine period. So it's been quite an interesting challenge from a policy-making perspective, but that's kind of one aspect. The JobKeeper and JobSeeker. So these are 2, I guess, social security policies that were rolled out. The JobKeeper was money that was given to employers that were struggling struggling businesses that weren't creating the revenue they wanted because of coronavirus. So they were given sort of money to so they could kind of continue to pay their staff so no one lost employment during this time. JobSeeker was a sort of an extension of our social welfare policy, which gives money to people who are particularly vulnerable and struggling in Australian society. And so obviously due to coronavirus, we had a lot more people who were unemployed, students who couldn't work because they'd been laid off because of there was no work for them anymore. So this was about giving them an extra economic stimulus so they could continue, remain viable throughout the virus. The other one is the COVID vaccine. So obviously that's an issue, a topic at the moment. So this one was more just Australia going to some of the companies and universities that had really promising vaccines and securing early deals and, with those companies to make sure that when the vaccine was ready, and it's looking like it is, that we'll be have access to that vaccine. There's a new challenge now about how, now that it's ready, how do we distribute that and on what basis? But I think Australia did a good job of getting that vaccine secured early. And then the other one is just about telehealth. So that's online, like teleconferencing services. So expanding our doctors access to use telehealth, which is online consultations with their patients, so they can see more patients if they can't see them in person. So that means that we can still get that day-to-day healthcare taken care of. So those are just a few high-level things that are particularly interested to raise. But a big part of the federal response, I suppose, has been around higher education. Is around higher education, so universities. And I'll talk a little bit about why they've been so affected, but essentially we have about, in Australia, just for context, we have about 40 universities in Australia. A lot of those are in the state of Victoria and New South Wales, but there is a university in every single state and territory in Australia. And as I mentioned before, the federal government, so the government department that I work for, are responsible for funding universities and trying to ensure the quality and standards of universities, in addition to universities maintaining that themselves. And, you know, this is really important for Australia. It's our #1 service export, and I think it's our #3 overall export, because we get a high proportion of international students coming to Australia. Australia is really fortunate. We've got some really amazing universities that are ranked quite highly in terms of international rankings. So you can imagine that we have a lot of international students wanting to come and study here. However, obviously the big challenge to the pandemic is that we don't have international students able to come here anymore. And so that creates a new challenge in and of itself in terms of how universities are funded, but I'll touch on that in a bit. And I guess just another feature of Australia's higher education, which I always like to point out because I feel very lucky that I have access to it, which is called, it's called the help loan. And in Australia, it just means that there are no real barriers to studying higher education, because every Australian citizen can access a help loan, which stands for a higher education loan program. And that means that students don't need to pay for their degree up front. They can defer it to a loan, and they're only required to pay it back once they are earning over a certain amount of income. So that's just a really interesting feature. It just means that higher education is highly sought after in Australia, and it's also really accessible to Australians as well, which is really fantastic, and certainly something to be celebrated, I think. And then just on the right is a picture of my university, the University of Melbourne. It's also Kate's as well, so we're very proud of it. But yeah, so because of coronavirus, it's created some really interesting policy challenges. And I've just highlighted 4 here, including a little fakta kunci, a key fact, which is that 1.6 million, there are 1.6 million university students in Australia. For context, Australia has about 25 million people, nowhere near as many as Indonesian, but I think it's just important to highlight because 1/3 of those 1.6 students are from overseas. So in terms of like the first policy dilemma, I think for universities and for the government has been that without international students coming to Australia, the big problem is that there's a lot of revenue that universities get from these students that they're not getting anymore, because Australian citizens can access things like loans and the government gives them money for that. But in terms of international students, they typically will pay directly to the university for their degree. So without students coming, that means a lot of universities are not getting the money that they used to get anymore. So in terms of maintaining things like the quality of their research and the quality of their courses and paying their staff, that's been a really interesting challenge. Of course, you've got students who are studying online. So I remember when I was working in the student space, I had a lot of, people emailing me saying, I'm studying a science degree and I used to be in a lab and I can't be in a lab. So, studying online is really different for those students and for medical students where there's a real practical component. So that's been a really new challenge. Also, during pandemics, not that we've had many, or just during times of economic difficulty, you tend to find that there are a lot of Australians who want to upskill and retrain. Many people in this pandemic have lost their jobs. So a lot of people naturally turn to higher education as a way to maybe access a new employment path or to get the skills that might get them back into the job market again. It's really easy in Australia. As I said, we have those help loans. That means that higher education is readily accessible, but there is a challenge to make sure that do universities have the money and the places to take all these new students on board. And then, of course, you've got university research. I'm not involved in university research too much, but there's a real challenge when a lot of universities, particularly the ones with lots of international students, a lot of that money is used to fund research endeavours. And that's where a lot of universities get lots of revenue. It's where they get prestige as well. So not too long ago, one of our universities in Queensland was, quite, celebrating and talking about the vaccine. So there's in Australia, we could have a vaccine potentially coming out of Australia. So that's where a lot of the university money goes into those really exciting projects that are transforming and changing lives. So without, that money, what happens to university research? So those are just sort of 4 policy dilemmas I thought I would like to highlight for you all, because those are sorts of the ones that have been really widely discussed in Australian media, and have, in terms of a department and internally, we've really had to rally resources around these key areas to make sure that we're addressing these policy challenges. I will move on. So just quickly at the federal level, I just wanted to highlight four key things we've done in response to these challenges. So I suppose there are 4, and I think the first one to highlight was that during the pandemic and around April, the Australian government and the Minister for Education in Australia, he guaranteed universities their funding regardless of the number of students they enrolled. So that meant that they could really, so the government funds universities for all of their Australian students that they enroll. So that was a big, it was a weight off universities' shoulders. However, of course, they've still got the challenge of how do they look after their international students and their research endeavours. So another thing, the third thing I've got there is that the government provided a big stimulus in terms of money to give to universities to fund their research endeavours. I don't think it was enough to cover the money that they've lost, but it gives them a new base that they can work with. The other thing that was really interesting, and the second thing that I was quite heavily involved in, which was introducing new short courses into the higher education system. As I said before, there are a lot of people during the pandemic that had lost jobs and wanted to upskill and retrain. So the government introduced and gave additional funding and places for new short courses, so 6-month courses that can be done online in sort of areas of national priority. And so they were sort of rolled out in about April, May. And that was really exciting. And there was about 300 courses that were developed. The government didn't directly develop these. These were developed by universities and providers, but they were a way to, but we certainly promoted them. And it was a way to get people involved in studies so that when, the pandemic was over, they could jump back into the workforce and hopefully gain some new and exciting employment. And then the last thing, which has probably been the most widely talked about thing this year, and I've certainly been involved in, is a thing called the Job Ready Graduates Package. And so this was rolled out this year in response to coronavirus. And it's a very big and complicated package, so I'm not going to talk to you about it too much in depth. But it had a few elements that are worth highlighting, and that was that they restructured how university degrees were charged in Australia. And in so doing, they really gave a focus to, I suppose, what they considered to be national priority areas, or areas where the future workforce will be needed. So those were areas like STEM and nursing and teaching. And so those people who want to study in those areas get to, their degree is overall cheaper. They also gave a lot of money for additional places, so universities can take on extra students because they might need extra students because of all the interest in higher education. And then there was also a series of measures for supporting regional students. So Australia is a big country and we've got lots of people inland, and it's really hard for those students, speaking as someone who's come from a regional background, to access university. And typically those students are underrepresented in the Australian education system. So there was a couple of extra policies chucked in there around you know, giving them money so they can relocate for university, and, you know, providing some extra support to universities to take on those students. So those are just a few things. I think what I want to highlight a little bit, just interestingly, out of the Job Ready Graduates package, and probably why it's been a bit contentious, was because in making degrees like STEM and teaching and nursing a lot more expensive, a lot cheaper, they had to make some courses cheaper. And some of those courses included degrees like arts and humanities and social sciences, and creative arts. And I think for that reason, in the Australian context, it's been quite political. Speaking as someone who's done an arts degree, I had a lot of friends who were quite upset that maybe like people who were interested in those degrees would have to pay a little bit more. So just, I thought I would raise it, not so much to speak about how I felt about it, because it is quite a political issue, but I thought it would be important to raise that it was a package that addressed coronavirus, but it hasn't been a sort of a perfect rollout. And there was a couple of inquiries into the package and why it needed to be done, and certainly a few reforms along the way. So it didn't come out as a perfect solution, and it was certainly reformed along the way. So those are just some things I was particularly excited to highlight. And before I end, I just thought I would emphasize, as a policy maker, or maybe probably best to phrase it as shaper at the moment, because I don't get to make the big decisions. I get to work on the little fun things along the way. Just some things I've learnt along the way. I suppose the first one would be sensitivity. So as I said, you know, it's a really tough time for universities. You know, they're not a lot, because of all the money that they're losing because of international students, they're having to, you know, cut staff and cut courses. And so I think just in terms of how I've approached my policy shaping, and in terms of how I've dealt with stakeholders, because I have had some interactions with universities and university staff, I think it's just really being conscious of the issues. And so you're not coming in as seeming insensitive. I suppose that's probably the first thing I've learned. I think the second thing is neutrality. So I think the big thing in Australia, and at least for our public service, is the government is made up of, you know, the ministers who all belong to a political party, and they have a particular political agenda that they need to see through, and they believe will, you know, support the nation. Of course, it's never going to be popular with everyone, and the role of the public service is to provide that really neutral base, and to, you know, provide that impartial impartial advice. So I think, you know, even though I've sort of haven't agreed with every single thing that's happened to the higher education system this year, I think I've learned about how important it is for my role to be neutral, so I don't let that affect how I do my work and get the job done at the end of the day, which really is to serve the government of the day, whichever political party or person who is in charge. So that's been something that I've really, I guess, embraced this year. The third thing would be flexibility. Because of coronavirus, I think, well, and I'm sure many people could relate, people have had to adapt and change to all sorts of new circumstances and environments in a sort of, in at least the context of my department. We've had, you know, massive groups of people, you know, get taken out of the department to go work on some of the health responses and some of the social security responses that Australia has been a part of. And I was moved very quickly from my role in the sort of student communication space into this policy space really quickly. So in terms of flexibility, I think what's really helped me is understanding the higher education sector. What are the bigger issues that are going on just beyond my little area that I'm focusing on, so I can, you know, be equipped to be thrown in any situation and, you know, provide the sort of the right advice and provide the right skill set that can help the team and help the task at hand. And I suppose lastly would be around transparency and having a really strong evidence base. It kind of goes back to what I was saying about neutrality, but essentially when you are in a sort of neutral position, it is your role to provide the best advice and the best evidence at hand. So embracing things like the data that's available to you, and, you know, when there's time, really researching an issue, so then that can inform how you know, brief ministers and how you brief your senior staff is really, really important. And being really open and honest about where the information you got came from, and what the evidence base is and the accuracy of the information was really, really important this year in a, you know, a very kind of stressful, tight timeline period. If you can provide that sort of detailed advice, that's I think highly sought after in the Australian public service. And I would say any public service, regardless of what country you're in, we need people who are really excited about data and, you know, research, because it forms the backbone of, I think, any good public service. So those are just sort of my key learnings from today. So I'll just wrap up by saying, yeah, Terima kasih, banyak. And there's just my details on the screen if anyone needs them or wants to reach out and hear a little bit more about my experience. I'll hand it over now to Kate Purcell, who's also with me on the Australian Indonesian Youth Exchange Program, and she is working at the Victorian Department of Health and Human Services, and they've been really involved in the restrictions that have taken place there. So I'll hand it over to her because she's had a really stressful and exciting year. And as a fellow Victorian, I'm very excited to come back to Victoria because there's been a big border in place at the moment. So I'm really excited to come back, but I'll hand it over to her now to speak.
We're excited to have you back, Jayne. Looking forward to being able to see you in person. I'm just share my screen. Has that been successful? Make it a bit bigger. Can everyone see that?
Yes. Can you just turn on the slideshow? Okay.
Oh. Can you see my slides now?
Yes, it's visible. Thank you.
Yes.
Can you see my slides or my notes as well?
Yeah, we can also see your note.
Thought so. All right. Is that better?
Yes.
Great. Thank you, everyone. I want to thank everyone at the School of Government and Public Policy, including Danny, for helping us speak today. We're looking forward to it all week. So diving straight in, a little bit about me. So I grew up in Beachside, Mornington, same as Jayne, about 1.5 hours from metropolitan Melbourne. I studied a Bachelor of Arts at Monash University and focused on human geography and politics, and minored in law and international studies. And I graduated in 2018. I describe myself as a very service-oriented person with a strong work ethic. So I thought about where I would like to work, and I decided that policy making would be a really great place for me. And in particular in government, it's a real privilege to be able to be in government and shape the lives of so many Victorians. I also have a keen interest in international relations, particularly in the Indo-Pacific and in Australia's relationship with our closest neighbour, Indonesia. Very important relationship, and that's what's led me to join IEP 39. But on my career, I began it at the Department of Premier and Cabinet in Victoria, working on bushfire coordination. I then moved to work on audit coordination, and then finally joined as an international policy advisor in the South and Southeast Asia space, working on Victoria's relationship with Vietnam, with Karnataka in India and some other states in India, and our special ties to West Java in Indonesia, as well as Jakarta. We are in the Department of Premier and Cabinet a coordinating area for the subnational government, so the state government that Jayne was explaining. So it's like the province level of Indonesia. We directly serve our Premier of Victoria, who is the equivalent of a provincial governor in Indonesia. And we work to unify all of the government's policies to make sure that policy altogether makes sense across all of our departments. And in particular in the COVID-19 space, we've really come into our own as a state government. So my role shifted when COVID-19 began. We stopped working so much on the international space. Naturally, the Premier couldn't travel and we couldn't receive amazing visitors anymore, although we did manage to receive His Excellency Ridwan Kamil from West Java in January 2020, and I had the privilege of meeting him and organising his travels around Victoria. But when COVID-19 hit, we moved to working on international student support, so very close to what Jayne was describing. And an interesting part about that is the state's ability to step up to fill in some gaps that might be in the Commonwealth space and complement the Commonwealth policies that Jayne was mentioning. So we helped establish a financial hardship program for vulnerable and impacted students and temporary visa holders during that time. But then I had the amazing opportunity to move on to the Department of Health and Human Services and work in the COVID-19 space. So my team worked to create the restrictions on Victorians. And as I'll describe in a moment, they were very significant restrictions. And we've since implemented a roadmap out of the restrictions. So a little bit about Victoria, for those who don't know. We are Australia's second most populous state. We're really fast growing. We'll soon be the largest state in Australia by population. We are known for our Melbourne that Jayne and I attended. We host some of Australia's most famous sporting and cultural events. So we're known for the Australian Open, the Melbourne Cup, the Australian Football League Grand Final, Melbourne Fashion Week, all the fun ones. So we're a really lively state most of the time, not during COVID. We're also known for being a very livable city and have a really diverse environment, lots of outdoor space, really good public transport and world-class tourism. Our cultural and linguistic diversity, so close to 30% of our population are born overseas, and 25% speak a language other than English at home. So we are a hyper-diverse society in Victoria, and we really embrace that. So in terms of Australia's COVID-19 experience, as you can see, it's a bit asymmetrical. So we all experienced the first wave like most of the world, and that wave was really effectively managed across the entire country, mostly by lockdowns to some extent in each state, and some border closures for some of our states as well to prevent travellers moving across the country. As you can see, though, there was an anomaly. So Victoria, my state, experienced a drastic second wave. So we ended up tripling, I think it was quadrupling what other states experienced in the first wave. Explain a bit more about this. So in terms of the Victorian COVID-19 experience, our second wave began in June 2020. And it was actually on June 9 that we recorded 0 cases, the first time since I think about 29 February. So we had gone from 0 cases to just 2 months later, 725 cases a day. And in terms of Victoria's population, we only have a population of 6.6 million people. So this actually made us one of the highest per capita places in the world for COVID-19 during those first weeks of August. Moving on. So we obviously needed a really important and critical policy response, and we called this stage 4. It was a lockdown in Melbourne that was one of the harshest in the world, or has been described as the harshest in the world. We'd initially implemented a stage 3 lockdown that mirrored what our response was during the first wave in March, but the cases continued to rise, and that lockdown was not providing the change that it needed in the case numbers, and they continued to rise. So in a state like Australia, our contact tracing, which is what we do when we are trying to identify who a positive case might have come in contact with and help them to isolate before they potentially expose other members in our community, our contact tracing capacity is around 200 cases a day. So when we hit 725 cases a day, the contact tracing began to really slow down, and it meant that our state's resources weren't able to keep up. For example, in our wave, we had a very particular characteristic, which meant that close to, for every person that had coronavirus, close to 20 close contacts were identified, and each of those people had to isolate. And this was a lot of work for our government to be able to respond to that. In terms of COVID-19, in a state like Victoria, there's a very high likelihood of the COVID-19 becoming uncontrollable from just 25 cases a day. So as you can see, we had to obviously implement some really strict lockdown measures. So the first one was a ring of steel. So this was a boundary around Melbourne that was implemented by the police and by the army. And this meant that Melburnians weren't able to leave the city and go and infect regional Victorians. So it really protected our regional areas that are quite vulnerable. We also had a daily curfew, so we weren't allowed to leave our home from 8 p.m. to 5 a.m. We were only allowed to leave our home once per day at the start of the lockdown, only for essential reasons as well. So that would be grocery shopping, if we were caregiving, if we were permitted to go to work, but that was only for extremely limited circumstances. So this was only hospital workers, really critical services like waste disposal. And then we're allowed to exercise, but for less than 1 hour a day. So it was a really strict lockdown for 6 million people. We also had a 5-kilometre limit. So we weren't allowed to travel more than 5 kilometres from our home unless we had one of the reasons for one of the essential reasons. We also had mandatory masks in all places, and all Australian states closed their borders to Victoria. Actually, by way of personal anecdote, I'll explain to, I know that Indonesia has experienced really critical cases. In terms of Victoria, although the cases aren't the same, I think every Victorian will always remember where they were when they heard about these restrictions. I think even as someone working in government, and I understood the severity of the situation, I definitely didn't understand how strict they were going to be. So I was at the time in a small town just near my home, and I walked into the supermarket and all the workers were sitting on the floor, huddled around their phones to hear the announcement. Everyone was listening in, no one was doing their jobs. And when we walked around outside, everyone was on their phones listening, then starting to panic. And there was people crying around this particular area. So for me, it was quite a shock. And I think it was very traumatic for a lot of Victorians, especially being a policymaker and someone that would then work to implement and then ease these restrictions, living under these restrictions and living it in a very first-hand way meant that it was both a personal and a professional challenge at once, which is something that I hadn't experienced before. So yeah. So what caused our second wave? So Australia is really lucky to be an island nation. So essentially when COVID first arrived in Australia in early March, we implemented a hotel quarantine policy. So as Jayne mentioned, National Cabinet, they decided on a policy and we had 36 hours each state to implement this policy. Hotel quarantine is essentially Australia's frontline in defence against COVID-19. International arrivals are detained and they are taken to a hotel room. Most of the time it's a hotel room. And for 14 days after their arrival, they quarantine from the rest of the community so that they don't infect other parts of the community. So in Victoria's hotel quarantine program, workers working at the hotels actually contracted the virus. We're not quite sure how, but it's through some sort of transmission. And this then seeded into the community and then it began community transmission. In terms of our policy dilemmas, the first one that I identify is whether we go for COVID normal, which is what some countries like Sweden have done, where they try and continue life as normal as possible, but protect certain elements of the community, like old people who are particularly vulnerable to coronavirus. There's then suppression and aggressive suppression, which is seeking to bring the virus down to the lowest levels possible by using quite strict measures. And then there's elimination strategies. So far, New Zealand pursued an elimination strategy from the start, and Australia has achieved elimination effectively for now, but by doing aggressive suppression. The second one is communicating public health messages to multicultural communities and across language groups. So this was a particularly big dilemma in Victoria's second wave outbreak. So for example, our communications needed to be in 47 languages. And at the time, the Victorian government didn't have the capacity to make all of our communications in those languages. So there was a lot of examples of really poor translation coming out of the restrictions. And it meant that in particular areas of Victoria, we weren't able to get across the message of isolating the rules that I mentioned before and of the risk to your health that coronavirus can cause. Essentially, to help this the Victorian government needed to partner with community and faith leaders to get the message across and to dispel misinformation, which was really prominent in some of these communities, as well as a fear of government, which is very right, especially when the government is implementing such strong measures and there's not a lot of clear explanation about why those measures are in place. The next one is then balancing economic impacts with public health impacts. And Jayne and I have written an article that will be published soon in the strategic review that kind of deals with this. But essentially during Victoria's stage 4 lockdown, around 210,000 people lost their jobs immediately. They weren't able to go to work because of the restrictions. So for example, hospitality workers, some people in offices, a lot of people working in other service-based industries. So there was a lot of economic pressure from government, from the federal government and from across business to reopen early or to ease restrictions early, even while Victoria was experiencing still around 100 cases a day in late September. So there was a real question about whether we protect our public health or whether we minimize the economic impacts. And essentially Victoria decided that the best way to minimize economic impacts was to get the public health situation under control first. Another question was when and how we would ease lockdown. So once you go into lockdown, it's a very big thing, but coming out of it is quite challenging. When's the right time to both help the economy, but also to make sure that the public health situation is not out of control. Finally, as well, this is an interesting one I won't touch on further, but it's just about ensuring the legality of our restrictions. So obviously, to force people to stay at home during a curfew, for example, is an extreme policy. It's one that we never thought we would have to implement. And so to make sure that this was done in a legal way, in a well-explained way, and in a justified way is really critical, especially given that it lasted for so long. So this is just insight into what my team does. So we take into account behavioural insights, we take into account public health data coming in on all the new cases and where they are, as well as, whether people want to wear masks and whether they're saying that they're wearing masks. So we really bring together all of this information to make our decisions on restrictions. In terms of when and how to reopen, my team developed what was called our roadmap out of restrictions. So it looked like this. Basically, we had steps along the way, and when we hit certain targets, so for example, like less than 50 cases a day on average, we would be able to move to another step. Right now, we've now hit our final step as of a week ago, which is really exciting. Yeah, if you want to check them out, I think they're interesting policy documents to see how you restrict certain elements of life and then reopen them, of course. So one critical policy lesson that I think a lot of people in Australia have taken away from Victoria's experience with COVID-19 is to go hard and to go early into lockdown. So Victoria spent approximately 3.5 weeks in our lesser restrictions before we implemented stage 4. And there's some thinking in epidemiology and in data analysis that those 3.5 weeks were really critical and meant that our peak of 725 cases a day was much higher because we took too long. So for jurisdictions like in Australia with low or minimum community transmission, the best practice is to have a really swift and strong response to impose restrictions to stop the spread as quickly as possible and to allow contact tracing to get on top of that spread. Victoria ended up spending 122 days in lockdown. So while we've achieved effective elimination now, it took a long time. It was a really big damage to our economy, to our people, to our lives. I think that's a really valuable lesson for Victoria and for the rest of Australia. So South Australia in November, another state in Australia, they experienced an outbreak as well through their hotel quarantine. A worker had spread it through a local restaurant that he was working at to other people in the community, and they quickly found 35 cases. So the government imposed a really quick lockdown for 6 days as a circuit breaker, as they called it. And this is to like stop the spread and to make sure everyone stays put until they can find all the cases. The state was then able to come out of those restrictions earlier because they detected them all. So the risk of this is that a lot of people said that the government overreacted. From Victoria's perspective and what Victoria experienced, I wouldn't say that. But certainly it's a lesson learned from Victoria being applied in South Australia. Another one is public accountability. So the Victorian government, in response to the hotel quarantine breach that we had, commissioned an independent board of inquiry into the government's establishment and handling of hotel quarantine and about using those workers that and how they were trained and how that virus got out of hotel quarantine, because obviously, as I said, it's the first line of our defence. So I guess the ongoing policy challenge is how to keep bringing vulnerable Australians who are still overseas back to Australia and to bring in international students so we can restart some of our economy while also making sure that hotel quarantine is really safe for Australia. I also think it's a great thing that Victoria is able to be accountable to potential mistakes and commission an independent inquiry. I think that's a really amazing thing. Finally, effective elimination is possible in some places. A lot of people said that Victoria could never reach 0 cases, but Victoria has now reached 47 cases, 47 consecutive days with no new cases. We have no active cases. Overall, we had close to 20,000 cases and 820 people died from our second wave of the pandemic. Those kind of restrictions are now actually outdated. We updated them recently, but life is looking a little bit more normal now. And that's a photo I took in Melbourne, just reminding everyone to keep their masks on to protect Melbourne. The next challenge, vaccine development and distribution. That's something that both Australia and Indonesia is going to have to work on alongside the rest of the world. I think that's a really interesting one we could discuss. Terima kasih banyak. Thank you.
Thank you, Kate and Jayne, for the presentations that really extensively cover from the high-level policy implementations to the participatory approach that being driven by the community. So we have 2 questions from our attendees today. I will give you the answers and feel free to choose which one to answer that fits best to your expertise and you would like to address. The first question is from Ms. Diana Nafi. So her question regarding the challenges throughout the policy formulations. What are the key challenges that you may... Hello, is my voice audible?
Yep, bisa.
Okay, what are the challenges throughout the policy formulations in Australia regarding this issue? And the second question coming from Mbak Putriana, her question regarding the vaccine and the swab test. Is the swab test or vaccine in Australia given for free or not? How much does it take for a swab test and the vaccine there? Because in Indonesia, some vaccines are free and majority are paid based. So what about in Australia? So feel free to answer whichever the questions you would like to address. Jayne and Kate.
Really interesting questions. I'm happy to jump in first. In terms of the main constraints on our COVID-19 response, at first it was the government's ability to mobilise and to move resources from other areas to be able to help with the response. So that needed to happen really quickly, needed to happen with a lot of thought about it. But then the next response was getting the public on board. So what we were doing in Victoria was really new. It was something that was very strict, and it meant that we needed to make sure that the community was on board with the plan. There was a lot of criticism coming out. So part of that too was making sure that while we communicated effectively about the restrictions, we also needed to remember that the restrictions had a broader goal to them, and sometimes the immediate impact is less important than the long-term impact. So had we eased restrictions earlier and we still had cases in Victoria now, other parts of Australia wouldn't be open to Victoria. We wouldn't be able to trade as effectively. Jayne wouldn't be able to come and visit us. It meant that we were able to come back as Australia again, rather than as states. So there was a broader goal as well that was considered, and that really constrained what we could do, how quickly we could do it, to keep Victorians on board with the policy. Jayne, do you have anything to add on that from your perspective?
I think from thinking about it from like a federal point of view, I think one thing that's been really sought after by the Australian people in terms of a COVID response is just being really consistent in the messaging. I think what people have struggled with, and this is partly because states can have their own restrictions, and one state like Victoria can have a different set of restrictions to another state, and that's not necessarily a problem, but I think it's really important to make the message as consistent as possible. I think anyone finds it really frustrating when they're allowed to do something in one context and not allowed to do it in another context. So I think having a really consistent response and having a government that communicates that response clearly is super important. And I think I don't think it's been perfect for Australia. I think we've sort of had a few stumbling blocks along the way in terms of perfecting our response. So I think it's been something that's been interesting to watch as a policymaker, how we make the messages clear, consistent, and as fair as possible. And that's kind of how I'll round it off.
Okay,
the fairness.
That's really great because we know the complexity of formulations in policy, especially in emergency situations. The government need to give a timely but effective response as well. So if you don't mind, we have the last question from our attendee regarding the mental health issue, which is actually one of the problems in majority of country facing the COVID-19 pandemic. So if you can give a short answers, what are the current state of the government approach regarding the mental health issue during the COVID-19?
This is a tricky one. Jayne, do you want to have a crack at it first, or would you like me?
No, I don't know, like, admittedly, I'll speak mostly from my own personal experience. And I think my own personal experience is I've been based in Canberra for most of this year, where we really haven't been impacted by coronavirus to a great extent. And yet all of your policymakers are based in Canberra, and they're the ones who are making the policy around how we respond to issues like health and mental health and physical health. So I think it's been a really interesting challenge for policymakers and governments to the question of how can you empathize with people if you're not going through a similar situation yourself. And, to contrast, my sister has been in, and my family have been in Victoria, and my sister does, sort of struggle with her mental health, and she lost her employment due to coronavirus. So I think it's been a really big challenge for policymakers to really reach out beyond the bubble that they live in and really seek to understand how other people are feeling, because unless you can appreciate that or you're living through it, it's really hard to deliver really good policy. Australia has done some things, and we already have access to things like mental health services, but they weren't designed with the idea in mind that Australia would go into really large lockdowns where people wouldn't be able to see their family and friends, which is, a really important part of people's mental health. So I think I'll just put that out there as a context, and maybe Kate can elaborate on some of the policies and maybe some of her own experiences as well.
Yeah, in Victoria, I totally agree. From our perspective, there was a sense of solidarity with the lockdown. And for those in the community that accepted the lockdown, there was an understanding that it was for the greater good. Victoria, like the rest of Australia, is really lucky to be able to access mental health supports. And I think the programs that Jayne mentioned in her presentation around JobKeeper and JobSeeker are really important. It meant that some people who might not have had an income source, and that would have been a source of stress, were able to continue on living, albeit in the lockdown situation. So mental health issues, I think the impact for Victoria's lockdown being 4 months we're still to see that. We're still to understand what the impact was, and there was a lot of questions around how much it was impacting. But in terms of resiliency, I think Victorians have come out stronger, and for the most part. Desi, I'm more than happy to stay on if others are happy to stay on, and we could answer some of the last questions, but it's up to SGPP.
Yes, I'm about to ask you a question. Actually, if you don't mind, there are 2 more questions from our attendees on YouTube, actually, and this is very specifically for you, Kate. They are curious about Victoria case. So if you don't mind, the first question is from Tom Smith. His question is, how did your team handle the criticism of your policy by the media during the second wave? And the second question is, what do you think is the root cause of the spike in Victoria as opposed to another state? Because Indonesia as an archipelagic country also face similar situations. Some area is not having the spike while other have it. So if you could give a brief explanation, what are the causes, it will be our honor to hear from you. Thank you.
Yeah, thank you. They're both really interesting questions. In terms of the root cause first, as I mentioned, we had hotel quarantine that meant that we have active cases in our state, staying in hotels in our city, but they're effectively cut off from the rest of the state. But we have workers that go into them. For example, cleaners, security guards, we have police officers that monitor the site. And it's not quite known yet how it happened, but the root cause was these people becoming infected from people in those hotel rooms. And that's, I guess to an extent understandable. We have to provide them with food and services and make sure that it's a bearable experience for them being detained in quarantine. So in terms of a root cause, I guess you could say the government had a responsibility to get that program really right. And there's been a lot of criticism in the media about that you might have heard of. For example, one of the criticisms is that Victoria maybe should have used the army in those settings to, make hotel quarantine safer. I'm not going to offer a commentary on that. From my perspective, the report's coming out next week from the independent inquiry, and that will be a really interesting thing to read through. For me, I think as policymakers, it would be an interesting thing for all of us to look at, because it's a government being exposed and being questioned and being asked why decisions were being made. I think it's a really brave thing for Victoria to be doing. And I would like to know, from a personal perspective, what happened and why. But also I think it's really great lessons, for lots of other places, and really making sharp and impactful policy that is safe at the end of the day. In terms of the media question, which is really interesting, my team is obviously at the centre of the criticism for the restrictions. There was a lot of people who didn't believe in the virus or didn't believe in the restrictions. Naturally, if you've lost your job, you feel really personally impacted by this. And when you're losing income, when you're not able to connect with others and you're restricted to certain ways of life, it's a really personal experience. And 6 million people experience that differently. In the media, it was definitely important for my team to tune into that. So rather than leave it alone, we really needed to take that on board, because that informed how we actually responded. So when we saw mask behaviour becoming looser, so people reporting that they're not wearing masks as much or don't believe in wearing masks, we would increase communications, or we might consider not easing a mask restriction in order to keep it more stringent. Also, hearing criticism about, for example, people living alone during our lockdown. I was one of those people who lived alone, and it was very isolating. We weren't able to see anyone or have any guests over. You could only go out and go for a walk with someone for an hour, and that was once per day. So that was a really isolating time for a lot of people, touching on the mental health question. So our team lent into that, and we created a policy for people living alone. So it was that they could go and meet one other person once per day, and that person was designated for the entire lockdown. So they at least had a connection to the outside world. So as a policymaker, we had to be really responsive to all that criticism. I think our team did a wonderful job, and I'm really proud of what we did.
Yeah, that's really a very detailed answer, actually. And one of our attendee raised her hand. I would like to ask directly. So, Mbak Melanie, if you would like to ask question, please unmute yourself and state your questions.
Thank you very much, Desi, and thank you very much as GPP for the opportunity. So, hi, Jayne and Kate. First, welcome to Indonesia virtually, and then welcome to the big family of IEP. So, my name is Lani, and I was the participant as well of IEP in 1998, 1999. My program was in Canberra, Northern Territory, and then yeah. Oh, and then Indonesia. So basically, I'm happy to see you, even though it's virtually. And I think, you know, this is IEP itself is one of the policy that can be adapted with this kind of situation that you doing it virtually, you're doing it online, as might you. Maybe you understand that there's some aspect that might be not really like, you know, as a previous before, but I think you gain something through this new way of communication, way of doing the program. So there are three questions, if I may ask you. First of all is as you mentioned before that the first response for the COVID strategy overcoming is come from the federal and then being implemented through state. Is there any constraint, the main constraint, and then how's the what is the strategy to doing it? As because I think we have similar in Indonesia, like for example, in order to decide whether it's going to be a lockdown, we call it PSBB here in Indonesia. So it should be come from the central government, but actually sometimes the response is need a fast response from the local government. So there's a similar thing. I would like to know whether there's a constraint in terms of that, and then what's the most strategy, because I think congratulations for Melbourne and Victoria. So now you can free mass outdoor, right? So this really a breakthrough, and then it's a main evidence for that the policy that you implemented is really work. And then the second one is about the economic stimulus that you mentioned. What is the mechanism, and then what is the main thing? Whether you give it like finance, like transfer the money to the citizen account, or what else? And then the third one is about the public on board. Through the implement, I think you mentioned that the policy, it won't be effective if without the public on board on the implementation, right? So what's the strategy? And then I think based on the evidence that we have now, that Australia, and especially I pay attention mainly to Victoria because we lived there for 2 years there. So like that's really effective, that now you can manage the COVID spread, and then you can manage the number of COVID case in Victoria. So that's three things that I would like to ask. Thank you.
Terima kasih, Melanie. It was really nice to hear about your IEP experience. In terms of the response, I might tackle, I could probably tackle questions 1 and maybe a bit of 2, and then we'll go from there. I think in terms of the federal state question, it's a really hard one. I think partly because like constitutionally, states have, you know, a really strong set of powers and are in charge of lots of things, but also there are federal, you know, there are federal powers as well. And there is a great deal of time where they overlap in a really uncomfortable way. And I think the solution is not so much in terms of where people put their trust, because I think people have to, by the constitution, follow the government that has to roll out the policy, but rather communicate a lot more with the levels of government on a really regular basis to come up with a solution that's, you know, as much as it can be nationally consistent and consistent between states and states. So I think Australia hadn't had to really confront that challenge for a really long time. So I think it wasn't so much about who we put our trust in, but rather how we communicate the response and how we make that as much consistent as possible. Kate, did you have anything else you wanted to add?
Yeah, such an interesting question. From my experience in the team, the only interaction we really had with the Commonwealth was at the political level. So it was politicians through the media or directly discussing. In terms of a policy coordination perspective, public servants, there was not a lot of that. And that's because the Commonwealth government appreciated that the laws that are used to implement really severe restrictions are state laws. So we used our Public Health Act, and that's how we had the powers to implement our restrictions, whereas the Commonwealth doesn't have influence over that. I think also too, when state borders closed, it meant that essentially COVID was contained in a particular place and it wasn't anymore a national problem, it became a state problem. And I think that's another reason why it was reduced to that level. But in terms of national resiliency, the Commonwealth is putting together a national emergency management coordination mechanism. Jayne, you might know some more about this, but I think it's, they're looking towards that. But in terms of the COVID pandemic, it was really interesting how quickly Australia divided and became the COVID response was at a state level, and that was fairly accepted, except when coordinated through national cabinet. In terms of the economic question, it's definitely not my specialty. Victoria just delivered a really massive budget with a lot of stimulus, a lot of social policy measures, for example, a really big public housing spend to try and create jobs in construction, because construction's starting to drop off, but also to inject in other parts of the economy that have been really affected, like tourism, as well as, making sure that businesses can continue. So there's a lot of tax cuts. So it's one of the biggest budgets that we've ever delivered. So continuing business as usual is really important too. The Commonwealth looks after social support. So Jayne mentioned that in her presentation, making sure that everyday people have money in their pockets to continue living. But that's being tapered off slowly. So it will be interesting to see what happens to Australia's economy when that starts to happen. And the third part of your question, public opinion, really interesting. I mean, it's really important contribution to policy. I think it's really important.
And just to add, Melanie, about the mechanism, I know you were just interested in about how people get the money as well. I think at least in terms of how we got out job seeker, so basically that's implemented by the Department of Social Services and the organisation for that, and Services Australia. So there are lots of branches of Services Australia throughout Australia, and people have account numbers with them, and through that that ties to their bank account. And so depending on how vulnerable you are and your circumstances, that determines the amount of social welfare you're entitled to receive, and that goes directly into your bank account. So that's the sort of the mechanism. And because of coronavirus, this thing called Job Seeker, which was an additional payment for people who had lost their jobs, was added on to that mechanism. So people who were getting payments, who were already getting payments, got extra money, and some people who had never received a payment in their life signed up to Services Australia and started to receive payments, potentially for the very first time. And that was all implemented through Services Australia. And I know from at least my perspective, I had a lot of friends who were deployed to go and work for Services Australia because we had so many new people who needed accounts and needed to get money, and so many more Australians who needed that money. So that's just a bit of insight into the mechanism, I suppose, how Australians receive social welfare.
So this is get through the central link, because I'm familiar with that one when I was there. And then this is entitled for Australian citizen only, or for the permanent resident as well?
I don't know too much, admittedly. I'm not from Services Australia, it's not my agency. By and large, it's Australian citizens who receive payments, and there are some payments that permanent residents are eligible for, but I wouldn't be able to speak to you about the specifics of that.
Details. Yeah. Okay, I understand. Thank you very much. Thank you.
Great questions.
Thank you, Kate. Thank you, Jayne.
No worries. Thank you. It's so great to hear from you all. Desi, do you want to wrap up, or unless there's any more questions? Oh, we've gone mute, frozen.
Okay.
Are we all still here?
Yeah, Desi, are you still there?
Okay, I'm sorry.
That's okay.
I've had some problems with the internet connection. So I think our discussions today are really interesting. We discussed a lot from the sectoral level to the very base of the policy implementation, which is the community level. If I may to give a key takeaway that I learned from both of your sessions is like our policy making currently are experiencing a dual challenges. While the government has to formulate a timely and effective policy response regarding the situations, but also it needs to be correctly assess the real needs by the community as well. So I think if you may give your your message to our attendee today. We are coming from public policy students, so we are expected to be the future policymakers. If you may give us, what are your messages for the aspiring policymakers regarding tailored to your lesson learned throughout the COVID-19 policymaking, and to the public at large as well, what can be done if they would like to contribute to the policy making during the COVID-19?
Yeah, can I start first just because there's someone at my door? I think just in terms of for future policymakers, as someone who's only been a policymaker for about 2 years, I think my one takeaway from my very short years and experience would be to just embrace every opportunity and not to just think about your policy in isolation, but really ask yourself why does it matter and how does it connect to the broader set of policies. I think that's what's helped me really but be quite flexible in how I've moved between teams, because I've sort of kept my finger on the pulse in terms of the other challenges that other areas are facing and where we might need to, what we might need to address or pull resources to fix in future. So that's probably why my short takeaway. In terms of the second question, which was around how to engage with policymaking as a member of the public, I think it's really just to be engaged with government as much as possible. And I know that's sometimes can be hard if you don't have much experience. And I think there's a role for government to play in reaching out to people. But if you are concerned, I think there's such a role for citizens to reach out to local members and to reach out to their departments and raise their concerns, be part of public consultation processes. If you're part of an organization, make sure you're kind of involved in any new policy changes, because I think otherwise it's really hard to make sure your voice is heard when there's a big population. So those are just my two really quick takeaways, but I'm going to race to the door, but I'll be back.
I'll jump in there. That's another great question, Desi. I really appreciate it. For me, as Jayne said, really embracing the opportunity. It has been a really amazing experience to both live and create the policy that I live in. I think that having that firsthand experience is invaluable to making sure that you're on the pulse with how the rest of the population is feeling, but also then keeping in mind, as Jayne said, the broader inputs to that policy. So Victoria had a lot of considerations that we needed to maintain, and I think that we did that really well. We brought together a lot of different points of data, a lot of different public opinion. We considered, the politics and the economics all together in equal, and we created really frank and fearless advice around that was appropriate for the epidemiology, which guided us all the way. So it's really having a direction that you're going to. The roadmap was important for that. But then it's also making sure that you're flexible enough to be able to to lead with appropriateness for the situation. The other question around getting involved in public policy making, as Jayne said, you really need to be engaged in the policy first to understand it. I think, doing a Master's of Public Policy is a great first step. And then I think government's the next best step to then see how policy is made from that really high level. But policy is made everywhere, and it's made in business, it's made, in every NGO. So I think that it's something that we can apply more broadly as well to make sure that the best decisions are being made everywhere. But you're all very well equipped to do that.
Yes, correct. Couldn't agree more to the point that you highlight. We are reaching to our end of the sessions today. Our discussion has been very thought-stimulating, and I am honored to moderate our sessions today and thank you, of course, Jayne and Kate, for sharing your knowledge and findings about the COVID handling in policy level overview. Because we are about to end our sessions, I am asking our attendee who are able to turn on your video. Please turn on your video. We would like to document our webinar sessions today before we wrap up our sessions. Mas Dani, would you please count the time for the screenshots?
Okay, Mbak.
Any other who want to turn on the video? Okay.
I can't because the host has stopped it. It's okay.
Oh, sorry. Wait. Okay.
This is also
So great to see you
a reunion event of the IEP alumni as well. So it's really interesting, our sessions today. So Mas Dani, can you count for the screenshot?
Okay. And 3, 2, 1, smile. Once again. 3, 2, 1, smile.
Okay.
Okay, thank you.
Thank you so much.
Thank you, Dani.
Thank you so much.
Thank you.
Thank you.
Mr. Dani.
Terima kasih.
I hope you'll stay healthy and return safely to the Australia without any things that unwanted, of course. Enjoy your time while in Indonesia, and welcome to Indonesia once again. We would like to once again thank you for joining us on today's sessions and share your knowledge. All the best for your articles. I'm looking forward to it at Strategic Review. And thank you for our attendees, our participants, and good afternoon, everyone.
Thank you all. Bye-bye.
Thank you, Desi, and everyone.
Thank you, Jessie. Thank you, Mas Dani.
Thank you.